Yeah, John Mulder, Chief Executive Officer of the Bendigo Healthcare Group. We're the health service that looks after a wedge which represents about 25% of Victoria from Kyneton up to Mildura, provide all acute services, subacute services, a range of mental health services, community-based services, an organisation of around 4,000 staff and volunteers and turn over about $300 million a year. Yeah, Crucial Conversations has been a fantastic project for Bendigo Health. It's part of our journey from good to great. We launched our new strategic plan recently. We reviewed where we'd been in the past. We'd made some fantastic progress, but to be an outstanding regional health service we need to do more. One of the things we identified on that journey of success was the development of our middle management team. Part of that project is a course we refer to within Bendigo Health as GMGR, Great Manager, Great Results. It has a range of different modules and components in it. One of those has been the Crucial Conversations tool. It's been fantastic. I use it regularly myself, the exec team as well. We hear on a regular basis people turn around and talk about fact or story as we guide a conversation and move from what previously wasn't so constructive to constructive dialogue and then positive outcomes. There's never been a period when our health service has experienced more change. We're in the process of building the $630 million new Bendigo Hospital. We're rebuilding essentially every part of the service in some respect. As part of that, we're introducing new technology. We're developing our team to take us from good to great, and we've also got a major undertaking in the form of the electronic medical record. So change management and change management skills have never been more important, more vital to the success of the organisation. And I suppose that's where today's program comes in terms of influencer training, to provide the team with a framework and with the tools to achieve the sorts of outcomes, the sorts of changes that are going to be so vital for our health service down the track.
I'm Robin Lindsay from Bendigo Health, and I'm the Executive Director of Organisational Development and Improvement. Within my portfolio is strategic planning, quality and risk management, accreditation, compliance, redesign, quality improvement, education and research, and also organisational development, which includes managing the change management for the new Bendigo Hospital project. Bendigo Health, like a lot of other healthcare services, is facing some significant challenges over the next decade to cope with increasing demand for healthcare services and increasing community expectation. So recently, when doing a review of our organisational capacity to meet that challenge, we identified leadership capacity as a real link pin in us being able to continue to deliver high quality services to the community. As part of developing leadership capacity, we look to Crucial Conversations to provide us with advanced communication skills training, and at that point the executive team enthusiastically embraced that opportunity. So the entirety of the executive team, along with a number of our senior clinical leaders, participated in the training in the first round, and we did that so that we could ensure that staff, as the training was rolled out, were well supported, but obviously also so that we were able to increase our own individual capacity to communicate. We're looking to Crucial Conversations to increase our leadership and managerial capacity. So specifically, we want staff to be able to converse and communicate about often quite wicked and sensitive problems in a manner in which their relationship is maintained and they get the productive, effective, efficient outcomes that we're looking for. So within that executive team, that may be with each other, it may be the way we communicate with the organisation as a whole. For managers, it might be the way that they communicate with staff about performance management issues. On the floor, it might be the way we communicate with each other about hand hygiene and infection control. So Crucial Conversations is a key part of our broad organisational development program. So we looked far and wide, and we hope have picked the best of breed of a range of frameworks and tools for us to achieve increased leadership and managerial capacity. So Crucial Conversations are slotted in really nicely with some of the other frameworks that we're using, such as the Studer Excellence Framework, and has really given us the capability to be able to communicate our high-level strategic vision to our staff and to our staffing group, and also have some of those robust conversations that we've needed to have as we move towards the building of the new hospital. After the successful implementation of crucial conversations training at Bendigo Health, we are now looking to the influencer model to provide us with some direction and guidance as part of our change management framework at Bendigo Health. So the influencer model provides high-level direction to staff as to the way in which we want change to be managed as we move forward at Bendigo Health, and also really practical training and skills to ensure the successful implementation of change right across the organisation. We are already using it in a number of change projects, and we intend to use it as we move forward and transition our workforce from their existing infrastructure into the new building that is part of our Bendigo Hospital project.
So my name is Bev Sutherland. I'm the Manager of Organisational Development at Bendigo Health, and my portfolio has three main areas. One is staff development, then there's the management and leadership development program, and also focused on building change capacity across the organisation. For me, the journey started probably about 3 years ago. I read the book myself for the first time and really enjoyed it, and thought that they were skills that could be used within our organisation. So from that I started talking to people at work, and we put together a proposal, and we're very fortunate to be able to link up with some of the other people across the organisation who'd been looking at these skills as well. And we were very lucky in that our Chief Medical Officer was one of the people who'd actually participated in Crucial Conversations training, and he really helped to get the Crucial Conversations training accepted by the executive and to get it into the organisation. So that was really important. So in terms of actually starting at Bendigo Health, it was about 18 months ago. So we're about 8 months into our journey, and we've had something like 100 of our managers trained to date. In terms of percentage, it's 82% of our managers have actually been trained in the skills, which is fantastic. The background in psychology, it was really important to me that any product we chose with relation to communication skills, that it have a strong evidence base. What I really liked about Crucial Conversations is not only had they conducted some research themselves, Vital Smarts, to demonstrate that the product works, but there was really strong evidence of a lot of good psychology theory that underlies and underpins the actual content of the training, which is fantastic. Interestingly, even though we had a measured culture that had problems, when we surveyed our target audience, which was our business managers, 97% of them said, no, it's okay, I actually don't need communication skills training, I'm actually good with that. We'd had people who'd been going out and accessing lots of different sorts of training in terms of communication skills, and that meant that they felt individually quite skilled, but we had no common language, no common view of what successful or appropriate communication looked like. So being able to provide a common platform was actually important as well, but I think not just common, but high quality and common. Our first program at Bendigo Health was an executive program where we had the whole executive, including our CEO. We took them off site and we had them joined by some of our senior medical staff. They participated in the training together, which was fantastic. It was a really good team building opportunity apart from anything else, and they got to enjoy the skills together, and that really helped create some enthusiasm. From that point, we then flowed the training down through the organisation. So we then went to director level and had 2 programs for our director level, and it then has flowed down to business manager level, down through to the supervisor level, and is now, 18 months down the track, heading into the general staffing tiers. In terms of the way that we've scheduled the program, there's been a few things that we've done. We've provided the training as it's meant to be provided, the 2 full days, and that ultimately works best. But we had to find some way of delivering it in a way that was flexible for our organisation and our staff needs as well. So what we have done is we've broken the program up into 3 part segments. So we've identified spots where it also breaks where it's into 3, and we've tried where it's Friday, 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 or where it's Monday, Tuesday, Wednesday in the same week. So we've split it around mornings, afternoons. We've tried to make it as flexible and as accessible as possible for our staff, and that's been really, really successful. One of the other things that we did, which was really important to the success of the program in our organisation, was to introduce skills groups. So not only did the people, participants go along to the training, but we then have scheduled regular skills groups where they can come along and talk about issues they've had, conversations that have gone well, times where they've stumbled, and they can work together to help overcome those problems. And some of those skills groups have become, people start to really rely on them. So it's been a great way to embed the skills, but it's provided some much needed support for our managers right across the organisation as well. So it's had this wonderful dual purpose. We have been on a journey, quite a long journey. In terms of our measured culture, we've had some significant improvements. We've had about a 30% improvement in our overall staffing culture across the organisation. In terms of the leadership indicators that we measure, there was improvement in every single leadership indicator with an over 16% increase in confidence in managers, which was fantastic. In terms of the actual managers who attended the training through the management program, and as I say, we're definitely rolling it out to staff now, but focusing on the managers who have mainly been through it. The managers themselves, 6 months post-training, we had 88% of them said they were still using the skills. And I think in terms of other training that we can compare that with, that's really quite amazing. We've been very, very happy with the Crucial Conversations training. So the next stage of our journey, for us, the logical step was to look at the influencer training. For us, we have a bit of a history at Bendigo Health, and I'm sure right across health generally, where we're fantastic at rolling out projects. We're often not as skilled at engaging people in the use of those projects. So we'll put in a system with the best of them, but we often can't then get people to use those systems. So we have the Crucial Conversation skills that now support people to be able to manage their projects more effectively and to influence the people that they need to influence as we do roll out those important projects that we need to roll out for our future to look as bright as we think it's going to look in a few years' time.
Very bright future for the Bendigo Healthcare Group. We've got the buildings, that's fantastic. We'll have the world-class facility, but to provide the world-class care, we need a middle management team with the leadership skills and the influencing skills that they might not have had in the past if we're really truly going to achieve our potential and provide the world-class care that this community expects and that this community deserves.